What's up guys, I'm here with Dr. Josh Lowe.
I'm the founder of Reason Physio, and I help swimmers get out of pain and get personal best times.
Today we're going to be assessing Sid behind the camera. Last week he had a little bit of shoulder pain, so Dr. Lowe is going to take a look. He's going to assess him and give us some recommendations. After that, Josh and I are going to get a lift in and just talk a little bit of shot. Let's go.
So last week when I was doing Olympic lifts on the jerk part, I kind of felt something in my rotator cuff.
Yeah.
Felt like instability.
Yeah.
It wasn't pain, it's just like an aching kind of dullness. So it wasn't like I couldn't move or anything, but it's just kind of something general. Yeah.
And it's kind of gone now?
It's kind of gone now. I just rested it, kind of worked on my external rotation. I don't know if that helps. I was doing it, but I worked on my external rotation, stability and strength, and then it kind of went away.
So cool. I'm gonna have you take a seat here and face this way for me. Let's just assess that strength and see how it feels. So I'm gonna have you go 2 hands up like this. Good. I'm gonna push in this way. Don't let me push both hands in, okay? Ready, set, go. Hold. 2, 3, 4, 5. Okay, so his left shoulder is a good amount weaker than the right. So even if there's not pain, we would call this an impairment, which is a lack of strength on one side compared to the other, especially if there's pain related, which last week there was. Yeah. And so let's go, do you mind just taking off your shirt for me? And let's go face down and we can see if we can reproduce that pain. Good. So I'm just gonna bring your arms out this way. So I'm just looking for what we call trigger points here in the muscle belly. Is that sensitive at all right there? No? So a lot of times if there's a trigger point in here, it can be indicative of weakness or lack of activation through...
I can feel something right there.
How strong is that out of 10?
Point, it's like you're looking for a knot or you're looking for something that's...
It is a knot where there's more tone in that part of the muscle, and it's also, there should be pain reproduced.
There's a little bit of pain where you're pressing right now.
How much out of 10?
Like a 2 or 3, yeah.
Not much though.
Yeah, not much.
That's pretty good. I'm gonna have you lay down on your side and then face me here. Strengthen the rotator cuff here. Go ahead and just support your arm this way. Roll on your side for me, good. And you're just gonna lift the weight up here. Support your arm with this. Rotate up this way. Good. And then lower back down. And you should feel it right back here. Can you do 15 of those for me? Do you feel it anywhere else?
No, mainly the
Awesome.
back right there, yeah.
We're training a fully extended, externally rotated position here, while the rotator cuff is lengthened in this position.
It's the fully lengthened position for external rotation, right?
Yeah, nearly.
Almost fully.
Yeah. Already getting tired though on that one.
It's tough, huh?
Yeah.
Yeah, so I'd start with this, and then I'd probably go into like a body blade or another kind of like stabilization exercise where there's like a faster contraction rate.
Do you care if it's an open chain or a closed chain or not really?
So this is obviously open chain. Closed chain, it's harder to activate the rotator cuff,
yeah.
just that one muscle,
yeah.
I would say. Closed chain is great for activating all of like the scapular stabilizers and all that other stuff. We need both, especially when you're stabilizing. 3 sets of this, 2 or 3 sets before we start working out is a great start.
So what am I doing here?
Yeah, so you're squeezing in here and then activating the rotator cuff at the top too. How hard is that?
I mean, I feel it. I feel it a lot. It's not like it's not
too light for 12?
No, I think it's like just right for me for 12. So this is just more rotator cuff strengthening.
And scap. Yeah.
So when Sid does this, his rotator cuff has to fire reflexively, right?
Yeah. So it's keeping it all
centered
in suction, yeah.
Golf ball and tee.
And all his scap muscles have to fire too, right? Yep.
Right. Serratus, low trap.
No trap. Yep.
External rotation stuff, all the scap and rotator cuff strengthening stuff. Should I be doing that before, after?
Before.
Before?
Yeah.
Before the workout.
Before the workout.
Anything to after?
So afterwards you can go lighter load, higher reps. A lot of times like after it's been fatigued, if you've ever felt like you've worked out or like you've done an upper body day and then it's kind of like throbbing, afterwards it's like really dull and you just like feel discomfort there.
Yeah.
That's like when it needs to just be activated again, right? So if you did like 1 set of 15 or 20 with like 2.5 or 5 pounds, that could be enough stimulus to like help that feeling go away.
So we're just getting the body temp up here, right?
Yeah. Get the heart going.
Do you have everyone do some kind of temperature elevation before your treatment too?
Depends on the treatment. So if we're going mostly strengthening and stuff, I will,
Yeah.
just to get the body moving. If it's more like mobility or they're a higher pain, like higher irritability patient, then I won't.
Yeah.
I'd wait until we're at that stage. Yeah. So just get the glutes activated first.
Right.
Bring up our glute med and glute max. Just activation. So isometric hold for 30 seconds, really.
Okay.
For the glutes, so this one's for reps.
Yeah.
Here, just going out.
How many?
10 on each side. So you get another one in standing. Focus on the hip extension first.
When you do jump on, you're gonna step from here.
Get the shoulders ready.
What's the biggest issue you see with injuries for swimmers specifically?
Lack of stability or control
Yeah.
with stuff. I think that, you know, when we're in the water, it's a completely different medium than like moving on land. And so swimmers aren't used to moving external load,
Yeah.
like on the ground with gravity as compared to in the water. And like most swimmers only swim.
Yeah.
And so their muscles don't know how to like properly stabilize. It's like everything is open chain all the time.
Yeah.
And so there's like no real stability that is created. One of my biggest goals with like every swimmer is to be able to get that like closed chain and open chain stability because they need it.
I know what you're saying. I think like with swimmers, if they didn't play another sport,
Yeah.
like they spent their whole life, their whole childhood just swimming,
Yeah.
just being in a non-aquatic environment.
Yeah.
And so when they get into a, you know,
100%.
an environment with gravity, they struggle to interact with it.
100%.
And that was one of the reasons we started the youth
Yeah.
performance, was so we can give, you know, swimmers an opportunity to like have us, you know, a sport that's not swimming. It's kind of like a sport, right?
Yeah.
Anti-early sport specialization. So what does that rehab program look like from an elbow standpoint?
Yeah, so the first stage with her was just getting the pain out. She had been in an extended like stage of inflammation that was longer than it should have been. And so just letting the body know that it can relax and not overreact and like get some of the inflammation out. And once that's out, then you can start building strength back in the right places, loading it appropriately, and then like addressing the movement associated with it too. Which we're not quite there yet. We're still in the like strengthening, loading phase.
The pain come back with the strength stuff?
Not really.
Not really?
Yeah. The goal is to not feel it, right? With all of those, which is always like a game of like how much can we, how much stimulus can we
you
add
apply
without it aggravating.
It's a little bit of guess and check, almost,
sure.
Unfortunately.
Yeah.
Oh, that was a nice one.
Yeah, starting to get into it.
He's warmed up now. And what did you say caused that elbow pain?
Too much, too early.
Too much spiking training volume.
Yeah, and then after it showed up, she just didn't stop.
After the pain,
Yeah, she just kept pushing through it.
That's one of the issues with high-level athletes is they're willing to push past pain and do
It's
whatever.
just like, oh, that pain is like 11 out of 10. Like I can keep going.
I can keep going. I'll just change my stroke a little bit. And I'll-
Which is what makes them great, right? It's one of the things that like,
it's what makes them great, but also gets them hurt too.
exactly.
It's catch-22.
It's a catch-22.
A swimmer has shoulder pain. They start experiencing shoulder pain.
Yeah.
In practice, what's the first thing they should do besides go see you?
I'd say honestly just check the rotator cuff for like trigger points like we did for Sid.
Yeah.
So you can kind of do that with a tennis ball or like a lacrosse ball against a wall and then like strengthening.
When you say trigger points, it's like they're rolling with the lacrosse ball and seeing what hurts.
What hurts. And so a lot of times with those trigger points, like you're looking for like a 5, 6, 7, 8, 9, 10 out of pain. Like it's pretty high and then it's reproducing that same feeling like either at the front of the shoulder, out on the side
So you're taking
that they
the
normally feel.
lacrosse ball,
And it's like back here.
both posterior and anterior.
Just posterior.
Just posterior.
Yeah.
Okay.
So you know the anterior part of the like infraspinatus and rotator cuff is like all just tendon.
Yeah.
And so that just like refers normally, but there's not a lot we can do. We can best affect the muscle belly and then that can change everything with how it feels in the front too. That infraspinatus like doesn't have enough capacity to handle the amount of volume swimming or training that you're doing. And so ultimately you want to strengthen that and then like all the scapular stabilizers sensors and stuff around it.
Controversial topic, but ice or no ice?
Short-term acute injury,
Yes.
ice for sure. Nothing wrong with it.
Yeah.
Contrast bath, all of that is like helpful. Long-term,
No.
not that helpful.
Right,
Yeah.
it's just a Band-Aid solution.
Right, yeah. When you're in the like painful phase though, like can definitely be helpful in like reducing that. So, but it is controversial because people nowadays are like, but the inflammation stage is like helpful. You should just leave it.
Right.
But it's like if you're looking at an athlete trying to get back into training or competing, like they want to get back as fast as you can.
Right, yeah.
So
Yeah, if you're racing in the Olympic final tomorrow,
yeah,
then you should ice.
you should ice.
You have ice.
Yeah.
You have shoulder pain.
And then LeBron is like icing his knees every night.
Right.
Yeah, even during games. So
I'll also start getting pain if I start swimming too much.
yeah.
So this is good for me to I don't have pain now, but like to prehab. I think that's also the key, right? To reduce risk of injury is even if you're not in pain,
Like easing into
just
it.
easing into it and then also just constantly doing prehab stuff and
Yes. Yeah.
continually strength training helps reduce the risk of injury. You think that when Sid was like crazy difference in the manual muscle test, it's like chicken or the egg? Is it weak because it was in pain, or is it in pain because it was weak?
I would say it's probably in pain because it's weak.
In pain because it's weak.
Yeah.
Okay.
If anything, it'd be like activation, right? Like
Yeah.
at least it's not as active because he's more dominant somewhere else.
Right.
So that's what we would look at in
Well, that's good then, because it's more. There's actions you can take for his case.
yeah.
Right.
Yeah.
For this one, just loading something that you can't do concentrically.
Yeah.
But you can load it eccentrically. So just pulling, push. That might be a little too light.